to the PRC seminar, not just because she's part of our seminar series, but she has a very long and wonderful history with our Prevention Research Center. She joined us, or we began working together during her dissertation when she wrote probably the seminal work. If everybody knows the Cleveland-Cuyahoga County Food Policy Coalition, Colleen was the one that wrote the first history and the development of it. I think that's when we met, probably initially. Not too long after that, she joined the PRC as a research associate and really launched one of our, I think some of our more very favorite project called Healthy Village, Healthy Child, which came out of, everybody remembers that? It was one of our true CDPR projects that we went in thinking we were going to do one thing, and we came out doing home daycare nutrition, which Colleen was a project coordinator of it and really helping to develop the, leading the development of the curriculum. That was when then Ben came on and became part of the co-investigator and research associate with the Freshling Project, and probably a lot more. But so this is a very exciting, I think, for all of us. Now she just tells me she's getting ready to go up for promotion and tenure. She is assistant professor at Cleveland State University, and you have the. I don't think I wrote it down. I will say yes. In the School of Health Sciences at Cleveland State. Everybody knows that she has a PhD in anthropology from Case Western. 2 seats up here if you want to come through. All right. So this is very exciting. This is a presentation, I'll give it to you, talking about the investigating public responses to racial health disparities, as she refers as ARCHES, or Americans' Conceptions of the Health Equity Study. Very exciting. This has been a long time coming, and as you all know, as an anthropologist, you collect a gazillion pieces of data, so we're all excited to see how you condense it and present it. But Colleen, thank you very much for joining us today.
Thank you so much for having me. It's like coming home, and I'm overwhelmed, and I love you all. So thank you for letting me do this. So a year ago or so, when Darcy asked me to do this, I was like, oh yeah, I'll have it all analyzed by next July. Well, I don't. So we're going to start with some preliminary findings. We've been kind of chunking up these interview questions and responses into like manageable sort of low-hanging fruit at the moment to sort of see where we can start with papers and stuff. So this today will really be a discussion of the sections of our interview, and a lot of you in here were interviewed, so you might remember how these questions go about the causes and explanations and solutions for 2 health disparities that we present. So. And I should say that this, Sarah Willen and Abby Williamson are the co-PIs on this, funded by the Robert Wood Johnson Foundation. So I want to acknowledge them. I also had 2 very lovely undergraduate Trinity College RAs doing the coding all last week to try to have at least portions of this done for me to present, and they busted their butts to do it, and I'm really grateful for that. And as always, everything that we do on ARCHES, which has been this really, really, truly interdisciplinary and mixed methods project, that everything we do is always as a team. So my co-PIs and our graduate student, William Tootle, who's getting his PhD in anthropology at UConn with Dr. Willen, is our project coordinator. So I'm grateful for them, and especially for Abby, who's teaching me more about how to quantify qualitative data, because it's harder than it's out of my wheelhouse in the way that it is for her. So these are my co-PIs, and this is our research advisory board team. So we have people locally, you probably recognize a lot of faces, members of HIP Cuyahoga, some people that I've worked with in the past, including here at the PRC, like Erica Chambers, and Rakaya Yerby, who used to be here at Case in the Law School, but she's now at St. Louis. So, but she's still working on stuff and has actually her own Robert Wood Johnson grant right now, looking at the use of equity models by cities and municipalities and regions. So, so all these folks, they were people that worked on the ESR part of HIP Cuyahoga with me. And then we have academic advisors to make it truly multidisciplinary, so that we have health policy and public policy, law, social sciences. As I said, Abby's a political scientist, and Sarah and I are both anthropologists, but we also have sociologists and medical doctors. So trying to make it, people always say interdisciplinary teams, and everyone here at the PRC knows that it's a lot harder than it is to do, but we try. So a little bit about this genesis of this project, which some of you know, is that it came from this idea of the concept of observingness, who Sarah Willen, the PI of the project, was approached by Robert Wood Johnson Foundation because of her work on deservingness. So she's done a lot of work with immigrants and how we think about what immigrants deserve when they come to this country. Do we use healthcare resources on them, etc. So she's written about what this means in the health domain. But we hear all the time, right, these views about it. This is from Robert Wood Johnson. Everyone deserves to live the healthiest life possible. And you have these similar kind of connotations with other major foundations, health foundations. But we don't always have this. We don't always have people agree with this. So the heated debate over the ACA led to a lot of people talking about these ideas around deservingness in a different way. So we have Congressman Brooks thinking that healthy people should pay less because they've done things the right way. So we're sort of differentiating between who deserves what in the health domain. And then you had Mick Mulvaney, who says that when he was talking about the use of ACA and funds and who we want to give health care to, it says it doesn't mean that we should take care of a person who sits at home and eats poorly and gets diabetes, right? So we're not all agree. So if we have this whole sentiment among public health professionals and our health foundations that we are all in this together and we are trying to build a culture of health and everyone deserves this, but we know that not everybody agrees with it, there's something there to unpack. And so the anthropologists on the project are really interested, especially in that idea of the culture of health, right? So what does it mean to have a culture of health, and what does that look like, and how would you measure it? So, in our conversations with how this was important, the Robert Wood Johnson program officers were asked us specifically, how do you measure this idea of deservingness? So the whole project is really trying to get at that through both qualitative and quantitative methods. But I will point out also that not just these national foundations, HIP Cuyahoga also uses the word deserves. Everyone deserves a place to thrive. So we see it a lot. So these are really the main research questions of the project overall. And if any of you anthropologists in the room know Sarah Will, and you know that they are jargony, and they are, this is just the way that she writes in the most lovely way, thinking about stuff, because her work is very detailed in thinking about this idea of deservingness, how it's contextual, how it's interpersonal, how it changes over time, and all these things. So what we're really thinking about is a sense of deservingness that people have about oneself. What do I deserve? What do I deserve in terms of health? Knowing that's relational and contextual, right? And then second, we ask people how to think about what different social groups deserve. So people who may be other than yourself. How do you feel about what they deserve in the health domain? And then what catalyzes changes in this? Because we know people change their views and their values over their lifetime. So another really key element of this is thinking about how views and values can be changed and modeled, because our sort of underlying ethos is thinking about getting people to have a more expansive view of deservingness. And you can argue and say that that's worthless and we don't want that, but if you're thinking about the way public health and philanthropies are thinking about it, they really are trying to get at this. So this research is in that vein of thinking about ways to motivate people to have a more expansive view. Wait, did I give this one? Oh, okay. So part of thinking about that shift in values is, this is how HIP Cuyahoga is involved in this research project. Can a health equity initiative like HIP Cuyahoga, which gets national attention and which we were actually going to do a comparative site, but we could not find a countywide. Since we started developing this project, I would think that there's some ones that we could use, but comparing something like Seattle-King County to Cuyahoga, it just felt too different, and so we couldn't really find ways to do a comparative site analysis. So for right now, it's a deep dive ethnographic into right here in HIP Cuyahoga, which I'm sort of an insider-outsider of because I've been involved in that initiative as well. So as I've been saying, it's a mixed method study. So this first phase of research has really been ethnographic research here in Greater Cleveland, and I say Greater Cleveland because we have gone outside of Cuyahoga County a bit, but and so we do participant observation at these HIP Cuyahoga meetings, and that was an interesting thing to try to get permission to do. So we have, and we as anthropologists document everything, so I had field notes and all these things, but they wanted to see everything that we were keeping and what we were doing with it and getting permission, and then again, subcommittee meetings, but I'm like on the subcommittee for eliminating structural racism, so I was always sort of this interlocutor or whatever. I was always insider, outsider anyway, but they allowed it and they were gracious enough to have us do this. And then semi-structured interviews with a wide range of stakeholders, which I'll tell you about in a minute, about how we sampled. And then a post-interview survey on an iPad, so that we could have these really open and personal conversations without getting all the basic demographic stuff that we wanted to ask people. Do you read the newspaper? Do you vote for Republicans? What do you vote? Like, we didn't want to have those conversations unless they came out, so we had a little iPad survey at the end. And then this is all to develop, which is where we're at this summer. We're in this transition from phase 1 to phase 2. of having a nationally representative survey with about 3,000 Americans that really is looking at these ideas around deservingness. And I'll tell you a little bit more about what we've gained and how we're developing something called survey experiments. But so the role of Hip Cuyahoga in this project, as I said, the observation of it, is really thinking about their work on wondering whose values, how people's values and perspectives change over time, and what role has Hip Cuyahoga played in perspective transformation. And what we learned early on in doing this is that we also had to kind of pull apart those people who had gone through the REI training. How many in this room went to the REI training, the Racial Equity Institute? Okay, not that many. So they did that, I know you did, Erica. They did these years of awareness raising where they had now thousands of people come to these, they have half-day ones and they have two-day trainings, and it's really about getting people to understand our racial history in this country and having an expansive view of racial inequality. So we learned early on that we had to kind of dive in, that they weren't, we as researchers were dying that they were not collecting the kind of research we wanted to collect from those things, like their post-surveys that they gave paper and everybody walked out the door and they didn't necessarily fill them out, and it was like, oh my God, you're killing me, I need to find out what people thought about this. So as much as we could, we tried to ask about that as well. And also because Hip Cuyahoga's framework is really modeled off of Robert Wood Johnson, so our funders were very much interested in that too, like what does it look like on the ground. And so the thing that their innovation that they claim in Hip Cuyahoga is that they are, there's always this idea of health in all policy in lots of these things, but they innovate and say health and equity in all policy. So again, getting back to the REI training and things like that, sort of unpacking that. What does that mean to like really be focused on equity, having it be a value, having it be an outcome that we're ascribing to. So again, this idea of perspective transformation, which is the concept that initiative has been using to sort of see how you change hearts and minds to then change policies, is kind of an interesting thing to be documenting as we go through this. Because we very lightly approached this project in an applied way. So it wasn't just, let's develop a concept of deservingness and let's just do what Robert Wood Johnson tells us to do, but like how can Hip Cuyahoga and local people who are working on health equity use these data in a meaningful way? So that's always sort of at the back of our design. So I told you we're taking this to a national survey, and there were lots of questions about how is Greater Cleveland and the people you interviewed there going to reflect the rest of the country and stuff. But we've successfully made the case that we're a bellwether, mixed, politically bellwether, mixed county. We have Republicans and Democrats, and that we could probably make this work, and that we could explore some of the testable hypotheses. But again, I'll talk a little bit more about some of the challenges in thinking about that, knowing what I know locally and what we heard from people. But the other cool thing about this survey that we're working on is that we're using survey experience, which to me is a new thing because as an anthropologist, sometimes we're skeptical of surveys, period. And so we've been really diving deep into how existing questions, validated questions that are used all the time are asked, and saying, no, we don't like that, and our data supports not to ask this question. One example of that would be, we have on the iPads afterwards a question about religion, and it has Protestant, Catholic, Muslim, Jewish, Buddhist, like the major religions, and then something else. And so many people were just saying something else because no African American participant that I had was identifying as Protestant. They were saying, I just wanted to say Christian. I wanted to say non-denominational, I want to say this, and that Abby was like, no, Protestant is technically everything that's not Catholic. And I was like, it may be technical, but people aren't identifying it as such. So I was like, we are changing that question on the national survey. And she's like, okay. So things like that. We just want to have more nuance in that. But these experiments, which is new to me, is sort of giving one group of people who get a survey trail, they get one set of circumstances, and they read another. It could be a video, a vignette, some sort of message you hear, and they each get different things. You have a control group that are matched, and you see if you get any kind of differences in the treatment group. So in our case, it's thinking about, whatever we're doing, did it increase some level of expansiveness, or did you change your mind on how you may have felt about something like that? So it's very lofty, I know. But like an example of one of the very first survey experiments was, what year is this? In 1940 by Hadley Contrail. So they asked the Americans this question, right? Do you think the U.S. should get more involved to help England and France? And only 13% of people said yes. And then when you say in their fight against Hitler, it still only went up to 22, by the way. But it was, it was still, it was, they called that the Hitler effect. And it was like, okay, so how we message it to people matters, right? And in a meaningful way, even if you're asking the same thing. So this is what we're doing sort of in thinking about this idea of fairness and health and deservingness in the big one. So, do we talk about phase 1 interviews? This is who we've talked to so far. And I think I have literally one more interview that I'm supposed to do, wrap around. But just to get it to 170, it feels like one's an odd number and bothers me. But so this was intentionally done because a lot of times, and I think in anthropology we do this too, where you always talk to the marginalized or the impacted communities, or and you get that perspective, which is hugely important to lift up those voices. But when we're talking about these ideas about whose values matter, we also need to talk about the people who have some sort of power. So the decision makers in our sample are elected officials. They're heads of philanthropies, people in government roles. So they have the power of the purse string, the power of the ballot. They have lots of power and wealth a lot of times. And then community leaders could be, we had grassroots leaders, like in clergy, people on the ground would be considered community leaders, but then also heads of community organizations and things like that. And then we had public health, and then we decided we were having health professionals, and we decided we wanted to divide it up into public health professionals versus clinicians, thinking that there's going to be different views on all this stuff based on where people are coming from. And then the community member sample was to sort of get so we can oversample, knowing that some of those others, there's going to be higher income, there's going to be higher education levels in those other groups, so we really wanted to have an oversample of sort of everyday Americans, but in Northeast Ohio. So as you see, our target was 50. We were only going to do 140 of these interviews, and we're at 169 because we kind of needed to round out samples. And one of the reasons for having so many in the uninvolved community members is that we needed to oversample for conservatives, because there was, in a lot of those other categories, there were not a lot of conservative voices. And so we're like, okay, we're hearing a lot of people who are on board. They want equity. They are interested in talking about this stuff, but we're not hearing those kind of dissentive voices. So, and you'll see that we have have it divided by like exposed HIP Cuyahoga and unexposed HIP Cuyahoga. And that's just try to see if there's any measure of, is there an impact by being involved? And knowing that self-selection is going to play a role, so we're trying to parse that out. Like, what does that mean to be involved in something like this, and how does that work on your willingness to take action and your views and your values on these things? So the interview topics were really wide. On average, they lasted about an hour and 20 minutes, but some lasted 3-4 hours. And I was saying to Elaine before we started, our transcripts are about 40 pages on average. I have some that are 90, so it's a lot of data of 169 people. But they're wonderful. But we talked about things. And as I said, we'd use the iPad afterwards, so we didn't have to get into the nitty-gritty stuff. We just asked people to tell us where they were born, where they grow up, who are the important relationships to them in their life, like who do they turn to in a pinch. We asked about this idea of, are you flourishing? And what helps you, or what gets in the way of flourishing and thriving? What do people need to flourish? Does everyone deserve it? Would you describe yourself as healthy, which is different than flourishing? And this is the key. This is not the topic of this talk, but we are working on that too, because we find really interesting things in the differences in people talking about what you need to flourish and what you need to be healthy. So then we talk about, do you feel valued or like you matter in society? And this was, of all our questions, we try to make them as neutral as possible, knowing we were talking to a range of people, but this one was sort of the most intentionally evocative. We asked people if they get their fair share of what's available in our society, and then we asked people if they feel valued and we feel like they matter. And so those are really interesting data to pull apart. Some people, as I'll talk about later, have an immediate objection to the idea of getting a fair share. So that's the fair share stuff. So here's the health disparities is the stuff I'm going to talk about today. So we asked them, we gave these 2 examples of health disparities. We asked, are you aware? What's the explanation? What causes it? Who's responsible for dealing with it? If we should be doing anything about it? And is there a role of government? So we're really thinking about this stuff in terms of like individual attributions of causes versus structural. So really thinking about, do people understand the sort of social determinants of health and in ways that would link to what action might come out of it. So, and we'll talk more about this. And then again, change in views and values. And change in fairness and health, and fairness and race. So we ask people really to kind of get at any of their personal experiences that may have shaped how they view race, themselves or others. And we've gotten really interesting stuff about this. So we didn't say, did you have a perspective transformation? But we've got these data. We've got data where people will say, it may have been a really formal thing, like REI changed my mind, or a class in college changed my mind, or just somebody's very personal experience of being at the grocery store with somebody and being treated some type of way. And so we have lots of different things. And same with healthcare. We ask specifically about healthcare if people will give really in-depth experiences of not feeling valued or getting what they think they need in the healthcare realm. So, and then just the whole idea and familiarity of the term health equity, which I will say we knew was going to be a triggering kind of a term, because it's not something everybody uses, which is sort of why we talked about fairness instead. But I'll tell you, there were challenges to that as well. And then perspectives on Hip Cuyahoga for Hip Cuyahoga too. So it's sort of like being able to say, it's kind of an internal evaluation without being an evaluation. Sort of, what are we doing right? What's working and stuff. And then how people feel like it's impacted their life and their work, and has it strengthened their ability to take action on equity. And so when I say conceptions of equity, we looked at this kind of image and asked people to respond to it. We also put numbers like 1, 2, 3, 4, 5, 6 and asked people to identify which one was them. And so this is another paper that we're working on right now to think about what those images are. And we could have used any image. There's lots of them. The Hip Cuyahoga's used the stadium one. Robert Wood Johnson prefers the bicycle one. So it's just, they're abundant out there, those equity images. But okay, so for now, for the remainder of this, I'm going to talk a bit about these preliminary findings on the perceptions of the causes of the disparities and the solutions. So again, we could have picked any of the disparities, because it's unfortunate that we have so many here in our region, but we chose to pick the gap in life expectancy in the county, specifically between African Americans and white Americans, and then disproportionate lead exposure in African American communities, which makes African American children twice as likely to be lead poisoned. And that one, we know, gets a lot of attention. It has a lot of significance, and it has a lot of national significance. So we were thinking about it. We were thinking carefully about what to do, but we landed on these for better or for worse. So again, we asked, are you aware? What causes it? Solutions. Who's responsible? The role of government. And again, really thinking about, are people blaming individuals, or do they understand that there's limits to how individual behavior can play out? So that's where we're at. So if we think about and this is based in literature, right? Because we know that there's been some other work on thinking about disparities and how much Americans know about disparities. And it turns out it's not very much, right? So the people in this room and everybody who lives and breathes this stuff all the time, it's hard to imagine how this isn't often, the lack of imagination that people have for that this actually exists, and that people are very surprised sometimes when we show them these disparities. So we capture those reactions, and we capture apathy, we capture shock, we capture people who are sad and really surprised because they may be a person of color who didn't realize this was happening to their community, and then you're like reinvigorating some trauma that you did not mean to do. And so we have a lot of different stuff that's built into these data that come out. But for this study, one of the major ones that goes back and looked at how people look at this awareness, we know that of the 2,791 U.S. adults, they found that people were aware that there are class and education differences in health outcome, but not race. So people always assume it has something else to do with it. It's about income. It's about socioeconomics. But we know that when we control for those things, there's still a racial disparity. But people, generally speaking, don't know it. So 73% were aware of health disparities between poor and middle class, but fewer were aware of the health disparities between middle class and rich people. There's still a disparity, but people did not recognize that as much. And only 46% were aware of disparities between blacks and whites in the U.S. So that's a lot less than seeing an income disparity, right? And then what they found was that respondent education, the people answering the question, their education level mattered and their political ideology, and they were strong predictors of whether, oh, I thought I changed that to health. Sorry. I saw that mistype of healthy disparity earlier, and I thought I changed it. The health disparity awareness. So we know that political ideology matters, we know their race matters, and we know their education level matters in how they're thinking about this. So in their study, conservative respondents with less education saw only racial disparities 32%. And so liberals were twice as likely to see them as, to understand racial disparities. So another study that looked at this stuff found similar things, a little bit better. They have these telephone interviews with 3,159 people. 52% of Americans were aware of health status and healthcare disparities between racial and ethnic minorities and whites. So it's a little bit better than the other study. But that's another typo I thought I changed. This didn't change much from 1999 to 2010. They were hoping that with all the work that was being done with the healthy people 2000, 2010, 2020, all these healthy people, that this was getting the attention it was, but they didn't really see it. They didn't really see improvement over this time in how people understood these things. And so the other thing that they pointed to in this study was that African Americans were more aware of black-white differences, 89% compared to 55% of whites, which is not really surprising, right? But it's saying that people of color who are experiencing disparities, or their communities are experiencing it, they can see it, right? There's sort of this proximity to the problem, and where this white folks were not there. So more work is needed to really unpack this and understand who knows and why and what do they know and what do they think should happen to it, because that's the next kinds of things that researchers are looking at, is what health messaging and what policy action is going to come out of this. Like, are people, even if they see it, do they still think that there's a need for intervention by the government or by otherwise? So Sarah Gullis she does a ton of work on deservingness and health and things like that, but they do a lot of stuff on social messaging as well. And so this is an experiment. They use experimental survey design, like our national survey will be. But they gave examples of news media clips where they were talking about type 2 diabetes, and in one they gave a genetic predisposition cause, another they gave behavioral choice cause about diet and things like that, and then another one they gave a social determinants frame. And they did find that the treatment group that got the social determinants were more likely to see those as the causes for the type 2 diabetes, and same thing for the genetic. They might be more like, the genetic one wanted more intervention because they thought, well, it's not their fault, kind of a thing, so we do need to do something about it. But the people who saw the social determinants still were not more likely to want political action to take place afterwards. So sometimes increasing awareness just isn't enough, right? Because it doesn't uniformly increase public support for policy action. So just to wrap up before I get to our stuff, I'm just contextualizing it because this is not, what we're finding is similar to this, but we're trying to dive deeper into these because we have data like on how people are talking about these things. So David R. Williams, who's obviously a very famous African American sociologist, a medical sociologist and public health professional, he talks about the need for effective communication strategies so that people do have an understanding of health disparities. But he also wants us to understand that we need more knowledge on this social patterning of awareness. Just what I said, that if your education matters, your political ideology matters, your race matters in how you view these things, and that we need to recognize that. So he talks about, he really wants to have research on increased empathy. And I think any of you that are in this room that are involved in Hip Cuyahoga, there's this discussion all the time on whether we are trying to change hearts and minds or we're trying to change policy. And can they be done in concordance, or should one be first and the other one follow? And this is kind of a tension that people who do this work are always at, where it gets frustrating. And I speak from experience as someone, not as the researcher on this, as someone that's involved in it. You feel like it's not getting enough done, but it's because we don't really know. We don't really know a lot about, if you do have more empathetic views of this, does this mean that you really want to have action towards it? So the one thing he talked about, and I don't have it on here, but he talked about a Davey 2009 study where they used loaded terms, or terms like saying we all value diversity, or health disparities are the canary in the coal mine, things like that, that did not work. Universally, people just rejected that kind of stuff. And we anticipated that. Like I said, we were trying not to use the word equity, even though it's in the title of our study. Like we knew we had to find words that were trigger words and to try to avoid them. But that we had that they found these ideas around personal responsibility coupled with social action did work. And this is what Robert Johnson is telling us too, that their word of choice is opportunity. And that tends to rule because it gets at sort of American values of shared sense of that everyone should at least have access to opportunities. Whether they take advantage of it or not, that's their fault. But that's sort of where we're at. But in our research, it's kind of complicating that, because this Davy study also found that they used the word fairness too, and I told you we used that in our study. But people were more likely to say fairness of place. So it's not about fairness between individuals, but that this place should not have the same opportunities and access as this place, kind of a thing. So it's sort of interesting to unpack what these are. But with that life expectancy gap, that's right from from his study, just to say that, what people also don't realize is that, going back to that, there's this additional racial burden that's on top of socioeconomics and class, that this is something that we do need to raise awareness about that, even if we're not really sure if that's going to translate into policy action. But he also talks about the evaluation of social policies is needed, because we don't do that a lot. We don't do enough to say what is working and what's not working. And then he also talked about this idea of building resilience and protective factors. And this isn't new, but we talk about these things. That's sort of why we were wanting to look at this word flourishing, because we wanted to look at sort of how people cope with and are resilient in circumstances, and what does that mean for the health protective behaviors and things like that. So a lot of what he has talked about resonates in some of the findings that we have. So I told you that this was the sampling size. The rest of these demographic data for now are just going to focus on the community member portion of the sample, because this is what I got at 6 p.m. Monday. The rest of the coding finished on the community member sample, and that's it. So this is what you get today, because I'm doing my best. So then it's really because, like I said, we had that intense process of moving to the survey, which was really important. But we did coding in this analytic memo process specifically for that, which was great. But I know you anthropologists in the room, where you just want to dive into what they're saying and pull it out and get their words. But we couldn't quite do that yet until now. Now we're finally in that thick where we can be able to say, I want to look at the way everybody's talking about this theme. So in any case, and I mentioned that we had to go outside of Cuyahoga County. In some cases, we went out to Lake County, because that's where I grew up, and I knew I could find conservative people. So they tapped into my Lake County networks out there, so it worked. I had to buy beers for them or whatever, but it worked. That wasn't coercive, I assure you, IRB. So we were proud that it was a range. We've got people all over the place. So and the gender, it was pretty comparable. The blue is Cuyahoga County, and the green is the community member sample. We allowed for a non-binary offer, so the numbers don't necessarily have that for Cuyahoga County, but the total sample is 58% female and 42% male, and a lot of that has to do with more women doing this work, as you probably know. People here at the PRC probably know, because it's usually a lot more women here. And then race and ethnicity, this was another really targeted thing to think about, like how are we going to get representative, but over-represent, persons of color when we're talking about racial equity and stuff. So we didn't want to, but we also wanted to get this political, so although it doesn't look like we're as great on the Hispanic and the Latino and the community member one, in our larger sample we have more, and actually many of the people that said multiple were identified as Latinx, but then put other things, so we didn't want to take that away from being multiple, but that's just, and it looks okay, I think, in terms of income. We had a little more lower income, or on the lower end, but we tried to get a range. We tried to get as much as possible to reflect we didn't have any in the 200,000+, not in the Cuyahoga County sample. Actually, so we have more of those, but they're not in the community member. I didn't say Cuyahoga County. Not in the community members, but in the health professionals and the decision makers. We got some money up there, so we got some wealthy people, but not in the And this was the one that we're really proud of because this was hard. And I say this because there's a lot of distrust of academics, especially among conservatives, so recruiting conservatives was difficult, but we really wanted to make sure that we could get people that would provide the range. Because you have flyers, and I put flyers out to recruit, or I go to my networks, and I'd hang them in libraries, and people would say, oh, health equity, I want to talk about that, and they would self-identify, and they tended to be liberal. And so it was like, we would have all these wonderful, wonderful information from really, really smart and committed people, but we were like, okay, but we need to know what other people are thinking about this. So we had to try to get as many people from different ideologies as possible. Okay, so I think I told you a little bit about this, phase 1 to phase 2. It's just to show, I mean, the methodology, you know how we've done the interviews and surveys, and but this process for now, just so you have an understanding of where the next stuff is coming from, is that we use some of the data that we have for this analytic memo process, which is on the complete sample, where we created a Qualtrics set of questions, 72 questions or something like that, where we went through each transcript, and we asked those 72 questions of each transcript related back to the research questions so that we can get at the survey stuff. So that was really, really time consuming because it's really just us 3 PIs and William doing this all the time. So, and then the code book development, we've been doing it sort of as is, or as we need it for different projects at the moment. So we have a master code book of the index codes. I don't know how many people are familiar with which techniques you use, but we tend to do index codes for the questions and then smaller subcodes for all the other stuff, and then developing the themes under that. So, and then we've been using Deduce software only because we all are in different places. And on Macs, you can't do that. I think with in vivo is what we found, but I don't love Deduce, so I'm not going to say anything nice about it right now. I should say that because they're really nice to us. The people are nice, but the program is clunky. And then, so coding reliability has been really key in developing the code books, but then in also redoing this. So we have these undergraduates, but all the PIs are working with them very closely, having them code a few transcripts. I go in and do this. We have a conversation. We've done this, iterative process for all of them. So try to be. So the second, or the first, when we go into these the examples we gave, I'll tell you that we didn't give this map. We see these maps all the time, and sometimes you see the one where it's from the Virginia Commonwealth or whatever, but we see these gaps in life expectancy throughout the county. And in our interviews, we do use images, but we did not use this. We just gave the statistic, and we said that on average in Cuyahoga County, African Americans can expect to live 5 years less than their white counterparts. And so, and then again, we asked, do you know about this? Have you ever heard about this? And how would you explain it? Do you have a personal experience with this? Which was a hard question to ask, and it wasn't always asked. Sometimes it evoked really personal and difficult and poignant stories, but they were important to hear. And then again, is this something we should be working on, and who's responsible for it? And then the role of government, which is basically, especially coming from our political scientists, but always thinking about, well, if we're trying to build political will, do people see a role for government in this? So yeah, so we know that it can be as much as it's 88.6 in the sections of Shaker Heights and parts of Gates Mills, and then 65.4 in Huff and Buckeye. So there's areas we see these different kinds of maps, and you could be really in any major metropolitan area and see it. But then you can also put this right alongside the redlining maps, which I'm sure this is familiar to all of you in the room, and it's just seeing them all. You can lay any of these other health disparities and see how they align with the redlined areas and say, okay, well, something's going on there. And we did not show them these maps because we didn't want to sort of evoke this, but we hear a lot about redlining in our interviews, actually. And I think that might be because of local efforts and because people are focused on thinking about it in that way. But redlining, for those of you who don't know, was granting preferential mortgage practices. Preferential mortgage practices where some people were excluded from loans, basically African Americans, Muslims, Jews, and then some people were given advantageous loans. So it was deemed a red area if it was undesirable and only certain people could live there, right? So it ended up being poor, mostly African American residents. So what do people say about this gap in life expectancy? And I will say, this is just thinking about my codes and the most frequent codes right here. So it's not this is not the most comprehensive thing, and I only picked ones that where it was at least more than 10 people of the 70, and this is out of 79. Some of the data are 72 because some people didn't answer this question. Out of 79 people, what did they say? So those are, it's not everything. The code book has more, but these were the top ones. So we hear this idea of socioeconomics and poverty, and it's not surprising. So you have that as one of the most common reasons given for the causes for this gap in life expectancy. And then you also see lack of health care. People believe that, even though I think like we have very few people who are interviewed that lacked health insurance, but we still see this as something that people identify as that must be the reason why. And then lack of access to resources, which here are not economic resources. That code was applied if people talked about sort of not knowing how to get what they need, and not healthy stuff, like not health literacy. It's not that kind of resources. It's thinking about transportation and assets in your communities and things like that. So they're structural in nature. But then we had quite a few people give non-structural ones, so lifestyle behaviors. So it's really thinking about unhealthy behaviors, smoking, drinking, diet, things like that. This isn't access to healthy food, because that's a different code that we had. It's thinking about it as personal choices, that people are not living healthy lives. And then culture keeps coming up. And again, anthropologists were like, well, you know, what is this about? And this code is really meant to capture this sort of Oster-Lewis culture of poverty notion, which has been criticized and pulled apart by anthropologists for a long time. It was taken up by the Moynihan Report. There's lots of stuff. I could give a whole talk on this. I'm interested in it, but it's not. But we are using that to sort of, when you hear sort of underlying racial implications or racist implications in how people are talking about these gaps, there's something wrong or bad about culture in black communities that makes them live less. So that it happens. So this is, we've gotten this frequently enough to have it be one of the higher explanations given. So when we say this code of culture, what does that really mean? Not surprisingly, of those 18 people who said culture, 15 of them were white. And so it's not to say that, you know, African Americans aren't also saying it's something to do with culture, but like I said, there's usually this undertone, because we also put responses in that code that led to something to do with family and parenting techniques and family structure. And so sometimes that's where those responses from African Americans were in that vein too, sort of thinking about something wrong with not having families around to keep people alive longer. So it's not always in the racist vein, which is something we need to unpack when we do further coding of the stuff. And then 2 out of the 18 of those people who said culture were liberal. So we're seeing that it's more moderate and conservative people that would have said this, and sort of that don't necessarily, they're white and conservative, and they have different proximity to, you know, inner city African American communities that we were talking about. And so we know race and ideology shapes views, and in what ways. So it's not surprising, because I gave you all that other background stuff in this national surveys that see this, but it's sort of thinking about what this means. So now we have their actual responses to it, and sort of unpacking how do we use what they said or how they said it, because these codes are not mutually exclusive, right? So someone could have said culture, but then also said poverty or education or one of the more structural things. And sort of we're looking for patterns among who is saying this, what are they saying, and what do they then propose for solutions, which is be the next thing. But I'll get to the solutions in a second. So the blood lead levels is the next one that we give. And in this case, again, there's the redlining map. So in this case, we don't give the redlining map, but we do give a map, and we say the top one is the higher, you know, the darker colors are higher blood lead levels, and then the darker colors in the blue means a higher concentration of African Americans. So we don't say, you know, and then we say African American children nationally are twice as likely to have elevated blood lead levels than our white children. So to be fair, I laid that out there because we prompted them with a focus on children and a focus on paint, because we say, as you know, up until the 1970s, there was lead in the paints, and children are exposed to it because of dust, and they may put paint chips in their mouth. So we've had this discussion now about what this means for moving forward, especially for the national survey, because we're thinking about it as using this to test we're thinking about using it, but then, people are pushing back and saying, well, if it's on children, you're going to have a more expansive view of deservingness. Most people are more likely to say children deserve some help and some input than they are. So we're trying to unpack their responses and thinking, is it just because we said children, or is it about other things? But I will say more people are just horrified with this outcome. And as you can see, there aren't really many people that did these non-structural things. So we're having a much higher level of thinking about it as related to poverty and old housing stock and landlords. People are blaming landlords all the time. So you do have a few of the culture and the access, but it wasn't. They're not high. They don't necessarily stand out as the ways that you do it. But for those people who do say culture, I will say I just wanted to provide 2 examples of what it was. Did I have that in there? I think 2 of the 5 people who said culture in this were African American. So I was like, I need to read those quotes right there. So I was like trying to figure out what it was. So here's one on the side, and she says, well, just like I was saying, she wanted to eat them, the paint chips. So she said she went to taste them, and my best friend wasn't watching her daughter, and she was paying no attention, or she didn't know I can't read from this angle. Is it on here? Oh yeah, it is. Okay. She didn't know this whole thing right here, this big disparity. So she was just saying, they were unaware. So this would have been tagged as sort of unaware and not knowing, but then also culture because she was saying it was parenting. So we had this discussion: is it parenting if it's an outsider, if it's a white person saying they're bad parents, or do we keep it as parenting even if people are acknowledging this? So we kept it as culture, but these are the kinds of things that we're working through now as we look at our codes more closely, especially as we do the whole full sample. But then you see, this was the more traditional one of what I was thinking about when people said culture. So when I was a little girl, but I never ate paint. So it's the duty of the mother and the father, if she's at home, to watch the children so that they don't ingest that paint. But a lot of times, they can't help it, I guess, because those children are kind of left to their own devices. It's a culture. It's a culture. And I know the parents can't watch the children 24/7, but the mothers are responsible for those children. So if they have to live under those conditions with cockroaches and whatnot, things should be done. I guess your tax money should go toward helping them, but the mothers have a responsibility to watch their children so they don't chew on wood. Come on. But those houses are contaminated, I know. Because she grew up in Hollywood, but... So here you see just like a different, right? You see that there's some blame, something's not going on. She understands that this paint is there, but why isn't the mother doing something more about it? So for me, these kinds of cultural things are interesting. But if we break down and compare just how many structural attributions compared to non-structural attributions, which I wouldn't say all are individual or outside of control, because we have a lot of times people saying biology or genetics, which it's hard to say, is that out of your control? It's like So we've been kind of just dividing up as structural versus non-structural. And you see that overall 88% appointed structural causes for lead, and 65% did so for life expectancy. So it's a big difference. But and so only 12% of people are saying non-structural, right, for the lead. So this gives us hope. Like, okay, there are disparities that you can present where people might say, oh yeah, this is out of people's control and we should do something about it. So we broke it down a little bit by race, just to see, as just one. You could do any of these things. We have all these attributes on people, and we'll be doing that to try to find these social patterning. But again, the interesting thing here is in life expectancy, African Americans are much more likely to see the structural attributes. And again, that goes back to that other study where you say you have this proximity to the problem, you're more likely to see that there are barriers, right? And then same with, so the non-structural ones for lead were also high, and the non-structural ones for lead were more white Americans. So 89% of them were saying that this is not structural. So again, if we see these patterns and we're thinking, okay, we know that they're white, conservative, and education level, and all these things matter, but we're seeing that there's some hope here, right? So we're thinking about this only in terms of how we might use this as an example to do in our survey experiments. So we went back and forth. I want to make sure I went the... okay, so we went back and forth about what that means in terms of figuring out if we could use 2 examples of disparities on our survey, and because of this, we were like, we should do lead, and because there's a national attention. And in Cleveland, it's about paint and in the environment, and in Flint, it's more about water. And so we're like, will it translate nationally? What about rural areas? Are they going to care about lead? Which is why we were also discussed possibly doing lack of access to healthy foods, which we know locally is a huge problem. And I said maybe that only comes out in our interviews locally because we work on this really hard in this community, and that all the work at the PRC and Hip Cuyahoga and everybody in this room. So it's hard to know if it's of national significance, except for we know that translates in rural areas really, really well, because there are food deserts in rural areas because they're very far from grocery stores. So we've been toying with which one and how to frame this to sort of ways, if we give a vignette about something, what could maybe change people's view on sort of structural determinants of health versus individual determinants of health. So what should we have done about these disparities? There's just one summary I have here. We have lots of different stuff, but the consensus on the most common ones for life expectancy was education and awareness. And this wasn't those people don't know any better. That was coded differently. This is people need access to sort of quality education, to knowledge and resources. And it's not about health literacy, because that was, again, it was a different code. It's about just general access to quality education, which is promising, because that's saying, okay, this is a hard to do public structural determinant, but it's a solution. And same with lead. There was an overwhelming, people really wanted to see government action and political will. And usually that was code enforcement or something to do with the landlords or something, but people saw that there was a need to do things. So the stuff that we'll be unpacking the rest of are relating the rest of these solutions to how people went to their causes and what that means, and try to figure out through all the other variables or the descriptors that we have with these things and what those patterns might be. But I would like to go back. You can see on here concern or nothing and personal responsibility, all those ones that have 6, economic opportunity. Those things are interesting to me to find out who's saying that. And I didn't get a chance before this, but we think about this stuff all the time, and that W.B. Du Bois 100 years ago said the most difficult social problem in the matter of Negro health is the peculiar attitude of the nation toward the well-being of the race. There have been few other cases in the history of civilized people where human suffering has been viewed with such peculiar indifference. And this comes out a lot in the African American interviews, because you'll hear, people just need to give a shit. Somebody needs to give a shit about this problem. And sorry, I'm probably not allowed to swear in this, but I just did. But there's just a general need for people to care, and not like, oh, people in that community need to care and get their stuff together. That happens sometimes, but someone just said there's a feeling of that lived feeling of discrimination and feeling at a disadvantaged position in our society that you hear in these narratives, and not just in this disparities section of the interviews. It's like it comes across throughout the whole interview, and talking about deservingness and fair share and being valued and all these things. So again, we're trying to get at whose story. Are there stories in here that we could tell somebody? And Miss Marilyn knows this because we dragged her to San Jose to have a workshop about this at the American Anthropological Association, talking about are there stories that we could share, people on different ends of the spectrum that would question your stereotypes of other people, and like, could we do that? So again, we're thinking about that, thinking about what that means. And I don't have, so we have who's responsible, we have beyond government, we have sort of codes for shared responsibility when people do say it's all of our job to do this, or communities need to be involved themselves. Community themselves need to take up paintbrushes and go paint houses, or people need to turn to the philanthropy or the nonprofit sector. So we do have those. But I will say that we do have a lot of people saying, even very conservative people, that government needs to step up and do something about this. Even life expectancy, right? So we have the federal government has a role in life expectancy. And people see local role for lead, which is not surprising, because I think it's often thought about as a local issue, especially here in Cleveland. But that, people, regardless of their political affiliation, still feel like there's a role for government in this. So just an example of government roles. I'm looking at the time. Okay. Do I still have time? Okay. So these are just some quotes about different ways. So these would be sort of more conservative perspectives on government roles. So people will say things like, some government programs are fabulous, some are absolute nightmares, right? So some government can help you, but it can hurt. You see right now, bad ideas control the government, and as a result, government is impeding prosperity and health. and good cultural help. So again, there's that culture thing. Like we need to, somehow the government needs to improve culture. Now they try, they're pretending to help by giving people all kinds of handouts. Handouts, handouts, handouts. But handouts are not hands up, help up. It's like, okay. So people feel, it's not good formatting, sorry. Like I said earlier, it's that the most local government possible. So these are people who are, once you ask them about government, they start, there's no government intervention, but they'll talk about it as a way that, well, when you ask them before who should do this, they think the government has a role, but then when they run to their political corner of, no, I don't want the government in there, right? So as little as possible should address it and go up the chain of regular government to the federal government, depending on how many resources they need to fix the problem. So it's thinking about the way people will respond to one thing and then answer it in another. And we really, and you have very open and candid conversations when you're not in these political realms, but then as soon as you ask about government, it becomes like a political thing, which is funny, which is why it's sort of at the very end of our interviews, because we didn't want people to feel that way. And then here's some contrary ones, or if they care, I think that the government should be helping us out with them. Well, I don't know that there is. Again, it has to be, I would say, government. And obviously it can't be passed out from the federal government to the state, to the city, but it has to be a non-political thing. Interesting, right? Because you can't have government be non-political, really. And I don't know enough about how government works to make that happen, but some structure where these kinds of statistics and populations, there would be government allocation. And this was just this, older white female Democrat who really felt like, well, someone should be able to figure this out. So just to kind of summarize before I tell you a few other cool things from other pieces of the interviews is really just thinking about what all this means. So that the qualitative data, I probably don't have to tell you, but I usually feel like I need to defend myself about how amazing qualitative data is. It provides so much meaning and richness and texture into your life, and it challenges assumptions. Like I said with Miss Maryland, you could read something. I have a transcript of a lower income African American woman who is complaining about all the people in her life that are on government benefits and what a fool she is for working for a living. And if I took that out of context and gave it to you, would think it was some white Republican male reading it, right? Like saying it. So it's just, and vice versa. I showed up at someone's house and the guy had an NRA for Life shirt on and he was ready to be all in my face as some liberal academic. He really wanted to show me how conservative he was. But his whole interview was about how healthcare problems we don't give people enough health care and how it's such a problem and why aren't we doing anything about this. And you could read that transcript out of context and think, who said this, right? So you challenge these assumptions when you're just talking to people in really open ways, which is the best thing about just doing sort of narrative and ethnographic interviews. And then we're able to develop these questions with a survey that's really grounded in experience, which has been challenging and wonderful, and I've learned so much about how to actually do this. But then again, that importance of proximity. And one of the things that we have learned over and over again, and it is that proximity to other ways of being in the world that helps you see a more expansive view of deservingness. But that's very hard to replicate. You can't replicate in a survey some meaningful interaction with someone else. So it's sort of thinking about what could we do with that? What could we do with that information? I don't necessarily have the answers for that, but I didn't realize those were white. I can't see my things. So just a couple of things before I wrap up and take questions is that I mentioned the whole fairness idea. We had done a lot of analysis for a presentation last year for the American Political Science Association about the ways that community members responded to those. When you think about what's available in our society, do people like yourself tend to get their fair share? That was the question. And then a follow-up, do you feel valued by society, like you matter? And like I said, were evocative to some people. Some people just answered them outright and didn't have any feelings about it, but some people were very they objected to the question of fairness, and saying, how do you get fair share? Everything's earned, and I'm blessed, or I'm lucky. And we have lots of different kinds of ways that we're thinking about how to use that sense of what you deserve and what's fair in the survey experiments. The health equity, I showed you the Apple health equity images. One of the things we're working on now for an APHA paper is thinking about, is this image useful? How do people respond to it? A lot of times we hear, where do those boxes come from? So who's paying for those boxes? And again, sort of thinking about, okay, if we're going to make things equitable for people, something's got to give, right? So it's like people look at it as a zero-sum game. And that the concept of equity was objected not so much in the same way as fairness, that fairness question was objected outright, but more that people are saying, this is a lofty goal. Everyone throws this word around, and it has no meaning because no one's doing anything about it, right? So there's a lot of data in there. And I mentioned the stuff about resilience and coping and these sort of positive aspects of health. So the other thing we're really comparing in our data is how people responded to what do you need to flourish versus what do you need to be healthy, and then what people deserve, because they were so very different. So even though we asked it in a way to say, beyond eating right and exercising, what do you need to be healthy? They would still kind of go to those, well, I wish I need to lose weight, and I need to go to this, I wish I had better insurance, I need to find a doctor. They go to really medical things, right? Whereas when you say, you feel like you're flourishing and what's helped and what's gotten in the way, people are like, oh, I would be, but I really hate my job right now. Or like, just sort of broader things about, I don't feel like I'm contributing, or I contribute at home and at my church, but I don't feel valued at work, and all these sorts of things. So we're thinking about these measures of well-being that exist out in the literature, the idea of salutogenesis, or the causes of good health, and we're thinking about what does that mean, and does that matter for messaging and for framing these kinds of ideas, and testing this in the national survey. So we're doing sort of a whole concept analysis around flourishing and thriving right now. And then how does that relate to these deservingness assessments, which is the way that we think about how people come to think about who deserves what and when in the health domain. So, this isn't meant to be in the extra slides, but these were just some other quotes about flourishing. So at this point in your life, do you feel like you have the access to the things that you need, and do people have what they need? So she says, I wouldn't, yeah, and no, yes. And I'm an educated black woman who works, who has a little bit of money. I ain't rich, but I have access to things. People, networks, more than others. But systemically, in society, because I'm African American and female, I don't have access to the same things as a white female in America. And I know that. So on the one hand, I do, within my own rights and within my own will, I have access to certain things. But on the higher level, overall, as part of the African American community, no, we do not. So we hear this a lot. People saying that they feel like they can be healthy or flourish, maybe, but people of color feeling weighed down by the fact that not everybody can and not everybody feel this way. So it's also thinking about, it's contrary to our individualism in this country and our rugged pull up your bootstraps narrative and things like that. So we have just a lot of interesting data on that. So the next steps, as I've talked about, develop our national survey, publish some findings, generate new insights for Cuyahoga, hopefully, if they're moving so quickly. So it's sort of thinking about how we'll use any of this stuff to develop as they plan. But that's currently the major goals. So I guess I can just ask for any questions or input on any of this stuff. And thank you.
7 minutes. So if there's any questions, no,
Yeah, I just shared with Elaine, just the last statement you made. And I've heard it before, and it's a very good question, and I've never had an answer to this question. I've often heard this saying, well, pull yourself up by your bootstraps. How are you going to pull yourself up by the bootstraps and you don't have any boots?
or straps.
Or straps. So, we talk a lot about government and policy, and I know we went through this a lot when we worked together in the framing of the questions. What does it mean to be healthy, and what does it mean to flourish? And, how we word things and certain things, and when you ask questions to certain people, they really don't know how to answer it because they don't know what it means. So, it could be a combination of both things, but I think as far as government is concerned and getting them involved, some of our policies are so antiquated that they need to be changed. They've been put in place in the 1930s, which I learned a lot working with Elaine and Suzanne. We talked a lot about redlining when I was here, and I'm still here. What does that look like? This is 2019, almost 2020. And some of those policies that were formed in the 1930s are still in place. And we're still trying to live under that regime of policies. So the government or the people at B need to come together, I feel, as a people in order for some of these policies or these government issues to be changed. Because after all, we have to keep in mind, people, that we put people in policy in these places of government. We voted them in, and we need to learn that we can vote out and find somebody else to replace them, and to put other things in policy in order to be more effective. Because nothing's going to change if these policies still stay in place. See, I'm just passionate. I'm sorry.
You just get on up here. Yeah, no, I would say, it's one of the favorite responses to this when we asked about this is saying, I know people who don't even know the tree exists. They're so far down under the ground. Right? So, or I have people who are saying, I don't understand why number one can't just pick the apples and hand them down and things like that. So you hear these narratives about redistributive justice without calling it that, right? So that's part of the things that you're thinking about. But then, like I said, a lot of people questioning, who's paying for that crates? Do I have to pay for those extra 2 crates for that number 6 or whatever? So, so I think we do have a lot to do. People, if you trying to find ways to talk about these things and get everybody on board is hard. But if you say, okay, this caused redlining caused their little number 3. Now, if you give those 2 crates, we might be able to do something. But I don't know if that message will work. And that's sort of what we're trying to think about. What are the ways that you get people to think about it more way and have the imagination to imagine what it's like to struggle and to not have bootstraps and to not have boots and just. There was actually just a recent article about that the people who are most likely to believe in bootstrap mentality are the least likely to be able to get themselves out of poverty and stuff. But,
sure.
Yeah.
Not sure how to ask the question, but in a big generalized kind of way. So part of what, according to what you said, Robert Wood Johnson's health equity, eliminating structural racism, that's part of what wants to be done, but a lot of the questions, conversations are all very personal, and it seems like the answer is trying to be developed through empathy and individualized conversations and individualized movement that will hopefully become approved. But if we're talking about structural, why is it that we're not really looking at more structural interventions? So, for example, the homeowner is the one who has the paint in the house that hasn't been updated. So there's billions of those, right? But there's probably only a few policies that dictate to them versus a company that actually makes the paint and then mandates for certain things to be changed in a certain time frame or, when they're built. So I'm kind of confused because I see that we're really working hard at empathy and trying to get people to change their minds and hearts, where we're not looking at a big, gigantic picture that we actually all could vote for and create change. So can you help me on that one?
I wish I could. Yeah, I mean, I have the answer.
I'm going by what you said you guys were using.
Yeah, no, so I think, Marvette, I'll let you pipe in too. I think it's a matter of, it goes back to, when we see this tension, anyone here on ESR for Hip Cuyahoga, we've had this discussion all the time, and it's usually a generational thing, and it's thinking about, okay, no, we just need to move ahead, change the laws, get stuff done, but then the idea is, and it's questionable. I'm not saying that's the right way, but what the idea of Hip Cuyahoga has been is to say institutions, government officials, our organizations, our academic institutions, we're all part of the problem as individuals. And so that even if we're on board, what we do or don't do, take it back to our organizations, is limiting the ability to have policy and structure change. So it's like there's not a clear sense of where that breaks down. I may be gung-ho about it. What am I doing at bringing it back to Cleveland State? How am I doing it? Do I work for an institution that believes in equity and structure changes? I mean, I do, and you do your best, and I think as individuals and people, I think that's part of the frustrating work of all this, right? As you know, all of this work is very hard. It's very slow, incremental change at times, if anything. But having the right people's hearts and minds change might be useful. So these were only community members I have. We have really interesting data. I really hope to be able to present it maybe to the next consortium or something like that, of the decision makers and their stories of their perspective transformation and what made them say, as business leaders or members of the Greater Cleveland Partnership or places that have economic clout in our society, which you've seen that recently, like with the John Panay at the City Club, and we're having more conversations about equity in economics than we've ever had in this region. So, you know, is there a way to start? Is it about changing hearts and minds first in order for those people to go back and be able to do something? I don't know. Like, I don't know what the answer is. I think for Robert Wood Johnson, they want everyday people to feel a connection to other people. They want me to say my health is interconnected with Jim's health and your health and everyone. It matters, and we want us to have that shared sense. Is that the right way to do it? I don't know. You know, I think, yeah.
So I kind of said that too, because you started with the Food Policy Coalition as your base beginning, you know, with your introduction. So it just seems like they're so far apart.
They are. Yeah.
Yeah.
Yes.
That was
Well, yeah. No, it's I'm not a policy person, but I recognize how important it is. So I guess my whole goal of doing applied research has always been to say there's really rich ethnographic methods that can be used to influence policy or to inform it in some way. And that's my delusions of grandeur that I have. Yes, Marvetta.
So, to piggyback off of the other ladies and your talk, there was a coalition, Yvonne Hall's group of concerned citizens went out and canvassed the citizenry of Cuyahoga County as it applies to lead-based paint, and they came in with a huge petition, and the elected officials downtown, in much of their import and interest mindset, refused to look at what the people wanted. And so, again, once again, just like with Dan Gilbert and his $88 million, the people who actually vote here in Cleveland should feel like they've been smacked in the face and told to sit down in the corner and be quiet. And in that sense, be incensed enough to want to do something, waiting for the overcome that many of us have waited for 55 years, that has not yet come. And so, as Marilyn said, if we continue to look at a ballot and go down the right side, because those things are strategically put together, and looking at the last names and feeling comfortable in keeping people in seats for 40 years, and your communities still are food deserts, still are full of lead, still are full of disproportionate equity as it applies, then don't expect anything to change if you don't. You know, it isn't about so much about quote-unquote parties, because quite honestly, our mayor got elected out in Gates Mills. That's where there are 88-year-old people who are funding the same old, same old. So that, as I spoke to you before, was one of the reasons why I got involved with a group called CORD, Clevelanders for Regional Development, because some folks called me up and said, hey, Marvetta, I heard that there are 15 rich white guys that want to figure out what's best for Cleveland. And I said, well, hell, if they knew that, we would already be in a better place, you know. And so I welcome each and every one of you to look me up on Facebook, Marvetta Rutherford. Go look up CORD. By design of it being a page, it's kind of hard to find, but I'll guide you to it. And we're going to be having movements, and we invite you all to come out and have your voices heard, because I don't know about you, but if they had served you crumbs instead of a half a sandwich, you would be feeling some kind of way here this afternoon. We have to have that same mindset wherever we go, however we go within this thing that we call collective life. So that's it.
That was awesome.
And thank you.
Thank you.
Wow. So, thank you. That was awesome. I'm sure a lot of things are going on in your heads right now. Hopefully, a lot of conversations will happen on the way out. Please stick around, chat with each other. Thank you for coming. Thank you for being here. Remember, so we'll see you back September 2nd Wednesday of September.
Yes.
Thank you.